Outgoing president of ExxonMobil and First Lady Remi Tinubu marks World Cancer Day, urging Nigerians to prioritize their health.
For all of Nigeria. That's number one. And secondly, the administration's support, in particular with the President's directives to encourage investment in the deep water, will, in my view, set us up for many years to come with many exciting developments. So this administration has been extremely supportive of the potential to expand oil and gas, low emissions oil and gas in this country. Very supportive.
ExxonMobil is currently embarking on one of the biggest oil projects in Nigeria, and the incoming president upstream says the company is at the moment considering expanding the scope of investment in the Nigerian oil and gas sector.
We're looking forward now to a refocused business focused on deep water. We have a lot of exciting prospects and opportunities that I've reviewed with the team just yesterday, and we're looking forward to advancing those as quickly as we can with the support of the President's directives, the support of the government, and we're very excited about the future here.
Away from that, Nigerian First Lady Senator Oluremi Tinubu has appreciated Nigerians for holding forth for Mr. President and still believing that the country will get to the desired destination. She gave this indication in Mina when she paid a private visit to the former Nigerian military leaders, Generals Ibrahim Babangida and Abdul Salami Abubakar, at their hilltop residences in company of the wife of Vice President Nana Shettima. Fatima Aliyu reports.
Partly to attend to a state function and to present 100 million naira to the wife of Niger State Governor Fatima Bago for onward distribution to victims of Diko Junction tanker explosion. She said it is only fair to check on the two from
the fabric, Nigerian fabric, and she has done a lot of things in order to bring out Nigeria. And she is Nigeria's #1 ambassador. I want to thank Your Excellency for what you are doing.
The wife of the president, however, appreciated Nigerians for believing that things will only get better. Fatima Aliyu, NTA News.
The theme of the every individual, regardless of their socio-economic status, deserves the opportunity to live a healthy life, free from the devastating impact of cancer. Nigeria's First Lady Oluremi Tinubu stated this in her message marking this year's World Cancer Day. She notes that cancer is a burden on millions of individuals and families around the globe, and, as such, demands a collective responsibility to combat, especially in Nigeria, where it is a leading cause of death. The First Lady, however, expresses hope that with determination and partnership, the narrative can change, and emphasizes the need to continue to unite and raise awareness about cancer, prioritize screening, early detection, and equitable access to treatment for all. Celebration, united by unique, she notes, highlights the significance of adapting cancer treatment to cater to the unique needs of each individual. She therefore urges all Nigerians to prioritize their health and support one another in the collective fight against this disease. Now, February 4, every year, the global community comes together to raise awareness, promote education, and mobilize action against cancer, which is the second leading cause of death worldwide, affecting millions of people, regardless of age, gender, or socio-economic status. This year's theme, United by Unique, emphasize on the importance of people-centered care, recognizing that every individual's experience with cancer is unique. Sandra Keme tells us more.
Million people died from cancer in 2022, with this number expected to rise to 13.2 million by 2030.
In this climb, we know more about breast, cervical, and prostate cancer, but there are other cancers that are very deadly, that people need to equally pay attention to, and that is lung cancer. Because the myths that people have believed about lung cancer is that if you don't smoke, you won't get lung cancer. But lots of Nigerians now that never smoked, are having, lung cancer. So I think, that we should pay attention, to all those cancers as well.
World Cancer Day, observed annually on February, aims to raise awareness about cancer, encourage its prevention, and mobilize action to address the global cancer epidemic. But how knowledgeable are residents on this disease?
Cancer is a dangerous disease that affects people's life.
So it's good to be checking yourself and know the condition.
As the fight against cancer is a complex and multifaceted challenge that requires collective efforts, individuals, organizations, governments, and healthcare systems have taken a comprehensive approach that includes screening programs and diagnostic tests that can help identify cancer at an early stage.
This year edition is very unique. That's why it's called United, by Unique, Unique by United. And the essence is for us, to make patients the center of, focus or conversation. Cancer patient passes a lot. Cancer patient, they pass through a lot. In fact, cancer turns the patient upside down. Everything about them, change dramatically once they started treatment. The drugs are very expensive. In accessing care, particularly in developing countries, is also a challenge.
Because majority of the things that we do in Nigeria and Africa is awareness of cancer, which is good. But as well, we need, as a systemic change, and that is advocacy, so that things would change. It's not just to know about it, but to know how can we change it in terms of prevention, in terms of research, in terms of patient care.
Stakeholders say by working together, the world can make a significant impact in the fight against cancer and create a world where millions of cancer deaths are prevented and access to life-saving cancer treatment and care is equitable for all. In Abuja, Sandra Akeme, NTA News.
Still talking health, the Federal Capital Territory Administration (FCTA) has declared zero tolerance for fake hospitals in the territory. This announcement comes after a health facility in Kapua Gaube community was shut down by the Private Health Establishments Registration and Monitoring Committee. The facility, Dada's Clinic and Maternity, was found to be operating without registration and conducting medical procedures in a rented apartment, unfit for health care services. Preliminary investigations revealed that a community lead elder had passed away after undergoing a hernia operation at the facility. Several other patients have barely survived procedures and required emergency medical care elsewhere. The FCT Minister Yeson Wike has reiterated the administration's commitment to ensuring safe and regulated health care services, emphasizing that facility accreditation is a simple process. The minister's commitment to healthcare is also reflected in his recent approval of 70,000 minimum wage for FCTA staff, demonstrating his focus on the welfare and well-being of both citizens and staff. With the shutdown of Dada's Clinic and Maternity, the FCTA is sending a message to illegal health facilities that it will not be tolerated in the territory.
I am Oluremi Tinubu, the global and national Stop TB champion. Many people have asked why I've chosen to champion the fight against a disease like tuberculosis. My reason stems from a deep personal experience. I once had a friend who unfortunately fell ill, and concealed the nature of his sickness until it was too late. Eventually, after he passed, we discovered he had tuberculosis. Sadly, due to the stigma and discrimination surrounding the disease, he would not speak up or seek for help. His death was a painful reminder that we could have intervened and saved a life if only we had known earlier. Tuberculosis is an airborne disease that primarily affects the lungs, but can also impact other parts of the body. Being airborne means anyone, regardless of their social economic status, can contract it. In Nigeria, one person dies of TB-related illness every 7 minutes, amounting to 206 deaths every day. Globally, one person succumbs to TB every 25 seconds, which is a staggering 3,456 lives lost daily. These deaths are entirely preventable because TB is curable if detected and treated early. If you or someone you know has been coughing for 2 weeks or more, coughing up blood, experiencing night sweats, or losing weight drastically, it might be TB. Please visit the nearest government hospital or primary healthcare center for proper diagnosis and treatment. TB treatment is free in all government and some private health facilities. Let us also remember not to stigmatize or discriminate against TB patients or those who have been treated for TB. Individuals who have been cured of TB cannot infect others. I call on all stakeholders, especially the private sector, to join us in the fight to end TB in Nigeria. Together, we can make a difference. Remember, TB anywhere is TB everywhere. End TB by 2030. Yes, we can.
Now, the leadership of Nasrullah Fatih Nasfat stated that its modest contributions to societal peace and development, as well as its social interventions and empowerment programs, are a testament to the core principles and objectives that NASFAT was founded upon 30 years ago. This was reiterated during the official flag-off ceremony of NASFAT 30th anniversary activities by the Kubwa branch. Yours sincerely reports.
Almighty Allah continue to bless NASFAT as an association.
The Kubwa branch of NASFAT has joined the global celebration of the Islamic organization's 30th anniversary. Members welcomed zonal and national leaders to the symbolic flag of